Good morning. Myself, Dr. Manisha, Assistant Professor, Faculty of Physiotherapy Department in RPIIT Technical and Medical Campus, Karnal. Welcome to our YouTube channel, RPIIT Academics. If you like the content of this channel, please don't forget the share, subscribe my channel. Now, discuss about the anatomy of Parkinson disease. The substantia nigra is a nucleus in the midbrain which is part of the basal ganglia. The substantia nigra is made up of two automatically and functionally distinct portions. First of is substantia nigra pars compacta, more darkened. Substantia nigra pars reticulata, less darkened. Most of the dopamine neuron of the brain originate in the midbrain and are found in either the substantia nigra. The dopamine neurons in the substantia nigra express a high level of pigment called neuromelanin, which accounts for thin, dark color. The substantia nigra par compacta contain more dopamine neurons, while pars reticulate contains more GABA neurons. Clinical significance. We can also see in the diagram cut section of the midbrain where a portion of the substantia nigra is visible, diminished substantia nigra as seen in the Parkinson disease. Parkinson disease is associated with the death of dopamine neuron in the substantia nigra pars compacta, which is due to neurodegeneration. When a significant number of these neurons have died, individual will likely to start to experience movement related problems like tremors, rigidity, slowness of movement, and postural instability, which are the hallmark symptoms of Parkinson disease. Etiology and the risk factor of Parkinson disease. Advancing age, first of all, advancing age above 60 years, mostly seen while young onset Parkinson disease. Is called patients develop Parkinson disease between 21 to 40 years. Sex male are more likely to get than female. Family history having one or more close relatives with the decreases increases the rise of getting low estrogen level. Most menopausal women who don't use hormone replacement therapy are more risk of getting the disease. Agricultural work through exposure to environmental toxins such as pesticides, herbicides, inhibits dopamine productions and promote free radical damage. These involved in farming and are exposed to such toxins have a great risk of getting the disease. Low level of vitamins. Researchers was found that people with low level of vitamin B develop severe Parkinson's symptoms, head trauma, trauma to the head, neck, and upper cervical spine increases the chance of getting Parkinson's. The second one is genetic mutations. People who have both young onset Parkinson disease and a strong family history of the disease are more likely carry genes linked to Parkinson disease, which include alpha autosomal dominant LRRK2P, PINK1, GBA alpha synuclein, and LRKK2. Other causes. Other causes secondary Parkinson's, which are caused by other disorders such as neoplasm, multiple cerebral infarction, and infection of the brain. Drug induces Parkinson's, which are irreversible. Positive drugs, neuroleptics, haloperidol, risperidone, Olenja, pine antiemetic, metachloramine, prochlorperazine. Parkinson's disease caused by degenerative changes in with symptoms of Parkinson's disease are combined with the neurological, yet patients fail to respond to anti-Parkinson drugs therapy. Multiple system atrophy, Alzheimer's disease often combined with the mild sign of Parkinson's disease.